Hello, everybody. It's Dr. Kevin Connors. It is the 29th. Hope my date is right. Maybe it's the 30th. What is the date today? Let's see. I better look real quick. I'd have the wrong date on there. Oh, my goodness. It's the 30th. I better change this. It is the 30th of May. Goodness sakes. How time flies. And it is 2018, I hope still. And we're going to talk about some questions that people had sent in, and to clarify a few things and an announcement or two, and then jump to questions. All right, so first things first, I realize that going through any difficult disease process, you're not feeling well, it can be depressing sometimes, and we all go through depression, at least most people do. I do sometimes, and I just get bouts of sadness and melancholy, and that's part of the grieving process. It's part of life. It's part of the emotions that God gave you. I don't think it's bad to have those emotions. I think you'd be in denial if you don't have those emotions, and it might be unhealthy. I'm going to start a series, and I will be posting it. We'll actually have a web page that you can go to for this series. That's going to be called Dr. C's. It's my 7-day soul cleanse. It's not going to be 7 days, but it's really 7 parts to it that you can take over 7 weeks or whatever you want to do. And it's basically going to be some preaching. So if you believe differently, if you're faith-wise than I do, it may be a little challenging to you, but I'd challenge you to at least listen to it. It'll be up on the website within the next week or so. And I hope that will help you, because sometimes I do things, as you'll notice, sometimes I teach things because it's what God is teaching me. So I feel like part of this ministry of a clinic is my responsibility to share with you what God is sharing with me. And you could disagree with it, you could agree with it, you could throw it out, you could ask God to reveal the truth that He needs you to know through it. And that's with everything that we talk about. I don't claim to know everything, and I do believe wholeheartedly that the more I do learn and know, the more I am revealed how little I absolutely know. So this series that's going to be coming up is really to deal less with health things, even though they're all interconnected and you can't separate the two, but it's to deal with that spiritual, emotional side of healing. So I look forward to being able to share all that with you. Now on to the topics of the day. We want to clarify some things. We have multiple questions come in, and these things I really feel like they need to be clarified. So one of the things is clarify ozone. I spoke about ozone last week, and one of the patients said it felt like I was kind of downplaying the benefits of ozone in cancer therapy. And I wanted to clarify that a little bit. So multiple ways to get ozone into the system, and that is the key. So can ozone be beneficial to kill cancer? Yes. The struggle with it is that ozone, by its very nature, is very unstable. So even if we inject it into our blood, the chance of it getting to my cancer site is minimal, or the chance of getting to my cancer site is not very high. So that's my struggle with ozone. Now, if the other way to get ozone is infiltration through putting it into a bag and then doing it rectally. So rectal ozone is a very good way to get it into your system. It goes through the bloodstream there, but still, as it gets into the bloodstream and travels through the blood to get to my cancer, the chance of it being stable and getting into the capillary bed and then into the tissue and getting to my cancer is very slim. Now, The difference is if I have rectal or colon cancer, ozone is perfect, right? So different types of cancer, ozone is going to be a great choice. So one of the patients who wanted me to clarify this has rectal cancer or colon cancer, and they were using rectal ozone. And I had told them, that's a great therapy. But then they heard me kind of diss ozone last week, and like they were confused. So it depends on the type of cancer. So if I have breast cancer and I'm going to do rectal ozone or ozone through the bloodstream, what's the chance of it getting to my breast cancer? Probably it's pretty slim. But if I have colon cancer and I do a rectal ozone source, that's a great tool. So it gets back to there's different therapies that have greater benefits for different types of cancers. So you've heard me say, okay, what besides the Rife would be good for my cancer? Well, it depends on the cancer. If I have liver cancer, my first choice for a secondary therapy would be the PEMF or the hyperthermia. If I have breast cancer, my first choice for secondary therapy would be the hyperthermia and then maybe the PEMF. If I have prostate cancer, hyperthermia wouldn't be on that list. It'd be the PEMF. So it depends on the type of cancer that you're dealing with. Is that therapy a real viable therapy? Now, if you have endless pockets, you could try everything and do everything, and that might be a good choice. However, everything takes a lot of time too, so maybe that's not the best use of our time as well. So always good if you hear me say something on this and it's not pertaining to your cancer and you want some clarification, just email. Make sure you put in that email header something that relates to Zoom so that we catch it. Remember, please don't email a bunch of questions through email. Your email will most likely get buried. If you have questions, call the office or put on the email header on the subject line Zoom question so it gets seen. I literally get 100 to 200 emails a day. So the chance of me seeing it can be slim. So I don't want you to think that we're ignoring you. Also, Facebook is the forum that you need to use to get your questions answered. If it's a more personal nature, then make sure you call and schedule a time to talk to myself or Angie or Michelle, and we'll get those questions answered. Another clarification is about Facebook feeds. Somebody called today or yesterday or something and said, I'm really concerned because I posted a question on the Connors Clinic patients only page and it came up in my news feed. Okay, so understand the way Facebook works. Any groups that you belong to and the Connors Clinic patients only page is a group. If you post something to that group or somebody else posts something to that group, it will come up in your news feed. Now, because it comes up in your news feed does not mean it comes up to the public. So don't confuse that. And I understand it can be extremely confusing. Oh my goodness, this is just a regular news feed that I'm looking at, and my post came up in there. Oh my goodness, can everybody see that question that I asked? It's kind of embarrassing. I don't want the world to see that. No, they cannot see that. Only people in that group can see that. So, but your posts in a group will come up in your feed. It does not mean that it goes to the general public, nor can any of your friends see it. Nobody else in the world can see it except those that are in the Connors Clinic group. So I know it's misleading because, oh my goodness, it came in that feed, but nobody else can see it. So make sure that you're clear about that. So feel secure about that. Also, another little clarification about Facebook. for the most part, we are only allowing patients on our Facebook group page. We do sometimes, if there is some, if the patient has an advocate that is doing most of their communication with the clinic for the patient. Many times, if the patient is very ill, their husband is doing most of the communication or vice versa. They are allowed on the group. But for the most part, even spouses we're trying to not allow on the group unless they are the patient advocate, and certainly friends of patients. And I know many of you have suggested your friends to get on the Connors Clinic patients only group page, and I have denied the request. So don't think I'm being mean, but this is a privilege for patients only, not for your friends and such. So just so you know, this is supposed to be a private group just for you guys. So that's the way we're trying to keep it. Other clarification about Rife use and foot baths. We get questions on a weekly basis about the use of the Rife and using other programs. Okay, so make this perfectly clear. The Rife should be your first go-to for everything. Now, I do not believe the Rife is a panacea for every disease known to man. But it should be your first go-to. I have an earache, run the ear infection program. I have, use wisdom. If you broke your arm, don't try to run a program of the Rife to heal your arm. But it should be a go-to program. I have a rash. I should run the inflammation program or find a program that may be fitting. There's poison ivy, I think, programs on the Rife. So try to use the Rife as a tool to help with any of your ills or any of your problems without becoming a crazy hypochondriac that your husband divorces you because you're sitting in front of the Rife all the time. But it should be your first go-to tool. You can't hurt yourself running any programs on the Rife, so use them. Clarification about the foot baths. Make sure if you're using the foot bath apparatus, you are switching. Follow the instructions in your manual. Flip the switch to bath and run only ion ProWave programs with your foot bath. Do not run other programs with your foot bath. There are programs to be run with the bulb. That's 99% of the programs on your Rife. And then there's a folder that says Ion ProWave. Those are the programs that you can run with your foot bath. Now, many of you, I have put an Ion ProWave program that I want you to run in your folder. Many of you, I haven't, but the ones that have that in your folder, then run that program. So just be clear about that. Look up your instructions. Every one of you was given a Rife manual, spiral bound kind of thing, and just look that up if you're unclear about that. If you have to call the clinic, you can go ahead and do so. The Rife function. We had a question come in that I missed. Sorry, you know who you are. About the function of the Rife. What does it do? Is it, if it's killing bacteria and things, isn't it killing my own cells? Boy, we could have a couple-hour discussion on the different theories on how Rife frequency works. There's multiple theories on how it works. I do cover this in some of my videos that are on our website on Rife theory. But just real clearly, is it damaging my own cells if I'm running a program? I do not believe there's any damage to your normal cells. If I'm running the liver frequency cell program and it's running through normal liver frequencies, it's helping bring resonance to my liver cells, and it's going to help my liver cells function better. Rife believed that running frequency of a cancer, and his whole thing was trying to tune in to that frequency of the cancer. If he could hit that cancer with its own frequency, he would cause lysis of that cell. And that's how he believed he had success with cancer patients, is that there was cell lysis. Now, I do believe that that may occur, but I don't believe that that usually occurs. If you do hit a cancer frequency with its own, cancer cell with its own frequency, remember a cancer cell is your human body cell. So if you have breast cancer, it is a breast cell that is in a rapid replication phase. One of the beliefs of Rife, and I do believe that this does take place many times, is that when you hit a breast cancer cell with its own frequency, a breast frequency, but breast cell frequency, you bring back normal resonance to the cell and the cell stops rapidly replicating. That's why you don't always get shrinkage of the tumor. So remember, what a cancer is. Cancer is cells that are in a rapid replication phase. Well, therefore, over time, there's a lot more cells. That's what a tumor is. So a tumor is cells that are replicating, therefore they're getting more of them and they're getting larger. And then with cancer, they're not going through normal apoptosis, so you're getting a mass that's getting bigger and bigger and bigger. And I've told you 100 times that our goal is not to make the mass go away. That would be wonderful. We just want it to stop growing, because if it stops getting bigger, then we know it's not replicating. So if we can stop its replication, this rapid replication, it stops, quote unquote, being cancer. So it fell off the definition of cancer, since the definition of cancer is rapidly replicating cells. So if we can get it to stop replicating, then we win. So that's the goal of this altogether. So one of the theories of Rife is that if you hit a cancer cell with its own frequency, liver cancer or breast cancer, and you can bring resonance back to that cell and it starts acting like a normal breast cell or liver cell again, it stops replicating. That doesn't mean the mass is going to disappear. So you have to get it out of your head that this mass in my breast may never go away. And that's okay. We just got to get it to stop growing. So that's part of the function of the Rife with cancer. Now there's at least 24 other theories that all are viable, and they probably are all applicable with how frequency medicine works with cancer. So now nothing's going to work beyond God's desire for it to work in your life. So we are dealing with that as well. So we have to deal with what the sovereignty of God has planned for the days of my life with this, but we're supposed to be doing our part. So the Rife is not a magic tool. It's not going to be a cure-all for everything all the time, but it's going to be a great tool for us. And then lastly, before we open it up to questions, I want to clarify some things about the Ivygene test. Now, remember what the Ivygene test is measuring. It's measuring free cell DNA. And in that free cell DNA, it's measuring tumor markers on the circulating tumor cells. So out of that, it's measuring, are these tumor markers, the tumor suppressor cells, are those percentage of those tumor suppressor cells that are turned on or turned off, and the tumor oncogenes, whether they're turned on or turned off. I mean the tumor suppressor genes, not tumor suppressor cells. So understand, from when you look at the DNA of a cell, you have all these different DNA that you can look at. Now, there are tumor suppressor genes and there are tumor oncogenes. So an oncogene, if it is quote unquote turned on, then it can stimulate a cancer production. It can stimulate growth. It can stimulate replication. Now, tumor suppressor genes, if they're not turned on, then it will lack suppressing the oncogenes. Kind of confusing, but tumor suppressor genes suppress replication. tumor suppressor genes decrease replication. That's why if I have defects in numerous tumor suppressor gene pathways, my risk for cancer can go up, and my ability to suppress cancer goes down. So there's two different things. When we look at your genetics, we're looking at your tumor suppressor genes, and we're looking at, do I have defects on those tumor suppressor genes? And I could have, let's pretend I have perfect genes and I have no defects on my tumor suppressor genes. Does that mean I will never get cancer? No, because getting cancer has nothing to do with tumor suppressor genes per se. It has to do with toxins. It has to do with things that got into my cell. It has to do with my immune system response. And yes, does it have something to do with tumor suppressor genes? Sure. If my tumor suppressor genes don't have any defects on them and they are turned on, then I will more readily suppress any cancer that's growing. If I do have defects on my tumor suppressor genes, and then the ones that are functioning are turned on, I will readily suppress the tumor that's growing, but less than if I didn't have any defects on that gene. So there's multiple other factors. We cannot just look at my tumor suppressor genes. We have to look at, are they methylated or not methylated? That's what the Ivygene tests. So the Ivygene test is not looking at, do I have defects? It's, are the ones that I have turned on or turned off? And are the oncogenes turned on or turned off? And that percentage is put into the factor that gives us our Ivygene score. So like any other blood test out there, any other CT scan, any other MRI, it's not going to be perfect. But it does give us a measurement that we can read out where our cancer's at. Okay, now I'm going to open it up for questions and unmute everybody. And I do ask that we try to keep to one question per person, unless nobody else has any other questions.
Doctor, I know this has kind of been explained to me before, but I still have a hard time with understanding the difference between like the Ivygene, onca, tumor markers and the regular, like when they just do a blood test on me and they give me my tumor markers.
Okay, so I'll mute everybody and answer that. Okay, so let me slow down so I don't misquote myself and use wrong terminology. So there's tumor markers that a person can test, and if you have a cancer that shows tumor markers like CA919 or CA125, those are tumor markers that can be prevalent in certain types of cancer. That's a blood test. And it can be extremely accurate for some people, and it can be inaccurate for other people. And then for other people, it might not even show up. So let's use the CA125, for example. Typically, that's fairly accurate with people with colon or colorectal cancer. However, I've had patients with colorectal cancer that their CA125 doesn't even show up. So it's like, okay, well, if it doesn't, you're not even showing high with CA125, and yet you have colorectal cancer, and you already had a section of your colon removed, and they're doing chemotherapy. I mean, there's no doubt that you don't have colon cancer, and yet you're not showing a CA125. Well, we can't use that as a marker then. However, in other people, the marker is a very stable marker. And if you look at it as a trend, then you can see that trend up or trend down, and you could use that as a marker. So a cancer marker is a blood test that you could use, use as a guide as you look at its trend to whether your cancer is improving or not improving. But you need to look at the trend of it. The Ivygene is looking at the genetics of the circulating tumor cells, the free cell DNA. So it's just a completely different marker. So it's a different thing you're looking in your blood. It's just like when you do a blood test and they look at albumin or globulin or red blood cells or white blood cells. These are different things they're looking for in the blood depending upon the test. And they are markers to other things. If I have a low red blood cell count and a low hemoglobin, then I have some sort of an anemia going on. So it's a marker to some other disease process. So it is with tumor markers. They can be a marker to a cancer, but they don't show up with everybody. So there isn't a perfect marker out there, and there's a lot of cancers that don't show positive tumor markers. That's the struggle. The other struggle with tumor markers is if the person is doing chemo, it tends to strongly skew the tumor marker score. That's why a lot of oncologists don't even test for tumor markers anymore. So if you've gone to an oncologist that they have tested for tumor markers and yours were high when your cancer burden was higher and it's lowered when you've gotten better, then that can be a good marker for you. Okay, I'll unmute everybody and hopefully that answered your question. If you still feel confused, let me know.
I guess like what was explained to me is the tumor markers in the blood work is just like measuring the protein, and they said protein is like a secondary indication of either it could be cancer growing or it could be cancer being killed off too. So that's what's so confusing to me.
Well, that's why when tumor markers were first discovered, it was really super exciting, and this is going to be a non-invasive way to see how my cancer was going. But as we realized that it became very difficult because typically when a person does chemotherapy, your tumor markers can spike. And that can scare the daylights out of the patient, like, oh my gosh, I thought I was doing chemo and this is supposed to be getting better. I go through this misery of chemo and my tumor markers went up 10 times. Well, it's because the cancer was going through a lysis, so it was eliciting a lot of that protein, and then it read in the score. So that's why a lot of oncologists don't like to run tumor markers, especially if the person's doing chemo. So it's nothing's going to be perfect ever.
Dr. Connors, is there anything to do to lessen ascites accumulating so fast?
So ascites is when the cell membrane is becoming quote unquote leaky. And then fluid is draining from the cell from intracellular fluid to outside of the cell. So when we measure your biometrics, when we measured that when you were in the office, remember one of the measurements that we looked at was intracellular fluid versus extracellular fluid. And what is intracellular fluid versus extracellular fluid a measurement of? It's really a measurement of the integrity of the cell membrane. When our cell membranes have less integrity, now that usually comes in with a cancer patient with their cancer cells rapidly replicating, the health of that cell membrane is not as well, and you start to get leakage of fluid that way. Secondly, you get ascites from fluid from capillary leakage as well. So water's leaking, and many times the reason why it is that minerals are being lost, and when minerals are collecting in the extracellular spaces, it's changing the dynamics of waste flow and water flow. So minerals attract water to them, and therefore you get a buildup of fluid. So the only real way to decrease ascites is to do things that will strengthen your healthy cell membranes, the cell membranes of your healthy cells. And then you go, okay, what are my cell membranes made of? Your cell membranes are made of a phospholipid bilayer. So good fats, coconut oil, olive oil, and phospholipids. So if you want to go directly to the source, that's where you use a product like phosphatidylcholine, and that's why we've been using more of that. That's that PC, the phosphatidylcholine liquid, or the phospholine product. That's a Zymogen product. They're actually both made by the same company, and the Zymogen just private labels it. So that using a phospholine, a phosphatidylcholine product, good fats are your main key. Now, I will clarify something else about ascites. So the typical line of thought with ascites from an oncological perspective is that ascites is going to be occurring in later stage cancers. And you'll get some oncologists that will tell you that, oh, well, you're starting to get ascites. This is what happens in end stage. So they won't give you a lot of hope. Like, you need to prepare to die. You got ascites going on. Well, the truth is, I used to think that too several years ago, because here you're starting to get bloating. We need to go in and have that fluid drained off. Oh my goodness, this isn't good. But we've had patients that have had fluid drained off for a couple of years now, and they get it drained off. You know, they might have 2-3 liters plus drained off the first few times they do it, and then pretty soon, as it starts to heal, they get less drained off and less drained off. They get less ascites, and you can recover just fine. So don't believe their thought process, and don't allow it to be put in your head that, oh my gosh, it's over. I'm getting all this fluid build up, and this is the end times here. And don't believe that. This is just another process through your healing process. The best thing that you can do is to go in, get it scoped to see where the ascites is, if it's in the abdominal cavity, and get it drained off. You will feel a ton better. So that pressure from the ascites, all that fluid buildup, is making you miserable. It can really make you feel lousy. It can really drain you. It can cause you to feel full. You don't eat as much if it's in the abdominal cavity. If it's in the lung cavity, you can't breathe as well. You're having a hard time getting air in. Don't let that fluid build up. If you're going in multiple times to get that drain, meaning more than once a week, they will suggest that they put a permanent or temporary drain tube in. I'd suggest you give that some serious thought, because then you could drain it yourself, and you will notice, a lot of our patients notice that, wow, they're getting less fluid and less fluid and less fluid, and they're feeling so much better again. So don't think it's the worst thing or worst case scenario. Just get it drained if you could get it drained. The only thing that you could do from not just a natural perspective, but any perspective, is support the cell membrane health. I'd also suggest, there is to make sure you're getting some mineral content in if you're not taking minerals, because if you're losing minerals into the abdominal cavity or the lung cavity, it will draw water with it. So if you keep a steady mineral content in your bloodstream, it will help hold the fluid from your losing from your bloodstream.
What are the minerals?
Okay, sorry, I just unmuted you. I have to mute you, everybody, after the questions because we're getting feedback from people's phones. Okay, go ahead.
We are taking the phospholine, except the last week or so, he can't swallow those pills. Can I do anything? We're coming to the clinic next week, but in the meantime, can we do anything to get that down? Can I melt them in something?
He could bite them.
Okay.
He can bite them. You can stick a needle in them and squirt them in his mouth. You can stick a needle in and then have him bite it. And once it already has a hole, it'll squeeze out. It's an oil. It won't taste good, and probably, but so what?
So you don't need the outside of the pill?
No.
And how do I get minerals?
Just as a mineral source. He's already taking minerals, isn't he? Isn't he
Well,
taking a mineral capsule from us? I don't have his
no,
file here, so.
I don't think so.
Okay, just if you want to remember to ask that question on Facebook, then I can pull up the mineral sample
Okay,
and show it on Facebook.
thank you.
One other thing, doctor, that you gave me advice on, I was having severe ascites for a while there. My cancer was advancing, and you had told me about getting on my hands and knees and doing the gravity thing, because part of my problem was cancer in my lymph nodes.
Yep.
And it wasn't draining, and that really did help. And like I was getting a lot of fluid in my legs, and I was doing the the exercises where I'm doing with the muscle, like you were saying, to flex the muscle a lot, and that was helping.
Okay. Okay, so what she's talking about, I'm going to mute everybody again. So what she's talking about is, I gave this exact same advice to somebody just this morning. So if I have ascites fluid buildup in my abdominal cavity, I can then end up getting fluid built up in my legs, and my legs don't drain very well, and I get swollen ankles and such. Well, why is that? Okay, well, the way the fluid drains is through your lymph system that drains into your veins. Now, your veins don't have a lot of pressure for the blood coming back, and your veins are they'll squash down, and just like a hose, that's maybe one of those flexible hoses that will, once you take the water out of them, they flop to nothing. That's kind of what a vein is like. So if you have fluid, a bunch of fluid in your abdominal cavity, it can push on that vein and literally squash it. So then the flow back from my legs isn't going to be that great. My blood pressure in my ankles is going to rise, and my capillary bed is going to get even more leaky, and I will increase swelling in my legs. And that can be extremely uncomfortable. So the same thing that I teach pregnant women to do, so this is a problem a pregnant woman has too, because she's got a baby growing in her stomach that is literally squashing her inferior vena cava, going back to the heart, that's draining her legs. So I tell them one way is to lie on your back and get your feet up. Well, that helps. It really does, because you're using gravity to help pull the fluid out of your legs. However, lying on your back is putting all that baby pressure or all that ascites pressure directly on the inferior vena cava and its branches. So another way to do it is get on all fours and just relax your tummy and allow your tummy to sag down. And then what's happening? The ascites, or the baby, is flowing to the front of your belly towards the floor, and your inferior vena cava, which runs right along the spine, is opened up. That hose is opened up. It'll help your legs drain. Also, your lymph flow functions on muscle contraction. Your lymph system has no capillary heart pressure that is going to make it flow in a direction. The way your lymph system is open-ended capillaries that have valves, one-way valves in them about every 2 to 4 inches. So it's only upon muscle contraction that the flow goes in a certain direction. So from your legs, you're standing up, you're sitting, you need to contract your muscles in order to get that lymph flow back upwards and cross that valve and be held back and continue to be pushed up that vascular system through valve, through valve, through valve, back up into the where it drains into the venous system again. So those are some hints to deal with the swelling in the extremities and such, but you do need to deal with the ascites in the abdominal cavity and the lungs. Don't be afraid of getting that drained.
Dr. Connors, the hammer bulb on the Rife machine, the all-night program, it's my understanding that it is DNA repair. Could you explain to me how that works?
So no, the hammer bulb that you're doing your all-night programming is not just DNA repair. Matter of fact, I don't have DNA repair in most people's. I have that program based upon your cancer. So, so that's based upon known frequencies for your cancer, frequencies based upon what we found as what we believe the cause of your cancer is, and on your hits on your scan. And
thank you.
So it's not just DNA repair. So I would, and I don't remember if I have DNA repair in yours at all. So if you do feel inclined to run that DNA repair program during the day, for sure do so if you have time.
Okay, all right. What is the one, then it's programmed specifically for me and my type of cancer for the night.
Yes, it is.
And the new hammer bulb is more effective.
The new hammer bulb?
I thought they have a new...
they do have a crystallized hammer bulb. Is that the one you're talking about?
Right, that's the one that I have now.
Yeah, you could use that. I don't, do I think the crystallized hammer bulb is more effective? I don't know. I have one. I've been experimenting with it. I'm not completely convinced that it's more effective or not, but if you have one, use it.
I didn't, I personally didn't notice the difference.
Yeah.
But I'm using it.
Yeah, I didn't either. That's why we don't push it. They're more expensive, and I haven't, I try things, and I'm not convinced that it's a lot better yet. So.
Mm-hmm. Thank you. Thank you.
You bet. Okay, well, I think we will wrap it up for the day. We'll get this up on Facebook as soon as possible. Make sure that you email questions in again, and you do put in the subject line that it's a Zoom question so that we make sure we get your question answered, and we'll get them on the next Zoom call. Be looking for our 7-day soul cleanse coming up very soon. Thanks much, everybody.
Thank you.
Thank you, Dr. Connor.
Bye-bye now.
Bye.